Thank you for joining us for the DNP, the Postmasters DNP virtual alumni panel. My name is Tom Kresh. I'm our Director of Graduate Admissions, and I will be your host tonight. Whether you're watching live or you're watching the recording, we appreciate you taking time out of your schedule to join us to learn more about the program. I'm joined by some of our best and brightest from the program to be able to walk you through their experience so you can have an additional tool at your disposal to use to kind of do your due diligence. This is a big decision to enroll in the program and to apply, and we want to make sure we're giving you the information you need to be able to make an informed decision. But before we go any further, if we could just start with some introductions. Dr. Park, could you introduce yourself?
Hi, I'm Lori Park. I am the director of the DNP program. And I'm a family nurse practitioner and I have my DNP. So yeah, that's me.
Great. And how long have you been at with Commonwealth or with Bloomsburg?
This is my 4th year teaching full time, and then I was an adjunct for a couple years before that.
Great. Thank you. Cynthia.
So hi, my name is Cynthia Rodarmel. I am a nurse practitioner at Geisinger Medical Center, and I work in the Heart Institute based in Danville, and most of my days are spent at Geisinger Schmoken doing and performing inpatient and outpatient cardiology consultation. I actually have been a nurse practitioner since 2010, and I actually graduated from Bloomsburg University also with my master's, and now that we are part of the Commonwealth of Pennsylvania, I did receive my bachelor's of nursing at Mansfield University as well. So I started my whole nursing career starting at Mansfield, Bloomsburg, and getting my terminal degree at Bloomsburg as well.
Oh, that's great. That's great. And how long have you been? You said you've been a nurse practitioner since 2010?
Yep.
Okay, great. Great. Thank you. Erin.
My name is Erin Bucher. Let's see here. I've been a nurse practitioner since 2019. I graduated from out of state. And when I moved to Pennsylvania and started working as a nurse practitioner, I started working with one of our program directors. She's now the senior associate dean for the nursing studies programs, Kim Olszewski. And she is the one who encouraged me during the pandemic to come back and get my DNP. So that's how I ended up going through Commonwealth University for my doctorate. And so I've been practicing in occupational medicine since I graduated with my nurse practitioner degree, and I currently work for DISA Global Solutions. And I was working in the clinic for 5 years. And in November, I transitioned into a more administrative role with the corporation, where I am an occupational health medical provider. So we are working to expand our telemedicine platform. And I'm also using everything I learned through the doctorate program to help write procedures and policies based on OSHA regulations, so that our company is up to date and help our clients stay compliant with the industry standards.
Great. Well, thank you. Thank you. And thank you for joining us. We appreciate you both sound very busy. So again, thank you for taking time out of your busy schedule to join us. So first one is probably the most important question. So you sound like outstanding students, right? Like you probably had great GPAs. You've been, very accomplished professionals. Basically, you probably had options. You could have gone to a lot of other places. You chose to come here. Why did you pick Bloomsburg? Why did you pick Commonwealth over some of the other options, Cynthia?
Well, I think that's pretty much a pretty simple answer for me. And I think it's because a couple reasons. One is that it's literally right in my backyard. I live I'm a cold cracker at heart. I'm originally from Schmoken. I live in Elysburg and I work in Danville. And so, I've seen so many alumni and nursing students come through and be colleagues. And I've seen a lot of my preceptors and mentors who have graduated from Bloomsburg University as well as Mansfield University. And so I knew that they had a very, very strong, longstanding reputation in in their academia. So I really did truly trust with all of the information that I had just personally with Bloomsburg and Mansfield. I really did entrust that I could be mentored to get my doctorate of nursing practice through Bloomsburg University. I started when it was still Bloomsburg University, so I'm still saying Bloom, but by the end when I graduated, it was Commonwealth. So, but yeah, it was pretty simple for me to pick the Commonwealth for sure.
Yeah, and for those of you who are wondering, Bloomsburg University integrated with Mansfield and Lock Haven universities to create Commonwealth University, a larger entity. So that's what Cynthia's referring to. Yeah, and I think one of the things that has always put our institution on the map is the Briner School of Nursing, right? Like when you think of Bloomsburg or Commonwealth, nursing is normally one of the things that, you know, you think of first, right? So I think there's some degree of like trust in the name, trust in the brand, in the program, because this is, you know, it's been here for a long time. And I think a lot of people know us for that reason, because of the success of the nurses and the success of the faculty in the program. Yeah, and you know, obviously we all of our universities are kind of in the shadow of major hospital networks, Geisinger being among them, right? So we have a lot of our graduates that are embedded in the you know, the Geisinger hospital system. Yeah, great. Thank you, Cynthia. Aaron.
So since I went to an out-of-state school for my master's program, I wasn't as familiar with programs in the state. And so when I started working at DISA, it was previously Mid-State Occupational Health. And as I mentioned, I worked with Kim Olszewski. Because I worked with her and her connection with the university, we had a lot of nursing students come through, both graduate and undergraduate levels. I was so impressed with the level of students that I was getting in through clinicals, that when we started talking about going back to get my doctorate, there wasn't even a question. You know, the level of education that I saw these students getting, that's where I wanted to do my doctorate. And because of that, I felt that when it came time to do my evidence-based project, it was seamless. It was absolutely seamless. I felt that I had great support, both in my workplace and through the university, just because of the clinic atmosphere that I was in and the experience that we shared with the university from the clinic level.
Great, great. One of the questions that I know that Dr. Park and I get frequently, and you might have been wondering as you were looking at options, is, oh man, I already work full time. I already have a master's degree. I have home obligations. You know, how am I going to fit all of this in? You know, basically, how doable is the program, right? Am I going to be able to survive if I start this? Can you speak to what the like what a normal week looked like, or maybe some of the best practices that you can remember that were really helpful in navigating that process of balancing home and work in the DNP program? Cynthia.
Yeah, so that was one of my scariest parts of choosing, should I go back to school or not? You know, like I said, I graduated in 2010. So I'm looking at, you know, 10 years out from having to go back to school. I did this when my kids were 18 years old, and well, my kids are now 20 and 16. So, you know, I graduated last year. So they were 19 and 15 when I graduated. So I kind of was like, oh my gosh, how am I going to do this? They are so active with their, you know, sports and stuff like that. But I knew that when I put something in my mind that I want to do for myself and make that commitment, I always find a way of getting through it. And one thing that I, you know, remember when I was interviewing with the faculty at Bloom was some of the little hints that they gave me was like, you know, you might be at a sporting event, but guess what? You're probably going to have like 15 articles sitting on your lap just reading, because you might have 45 minutes until your kid's next game. And that's really, I can truly say I did not miss anything that had to do with my kids, because my kids are my number one. And so, I had a very supportive husband, and even my kids were supportive. They understood, the work balance, flexibility. And the other portion of that is my work life. Work is over sometimes, most of the time, over 40 hours a week. But that was the one thing that I knew, and I had, that I was mentored through, was that when you do pick your evidence-based project to do, make sure it, I would highly recommend making sure that it has something to do with your everyday life at work too. So you can, implement that into your day as well. And that was something that I found, just like Erin said, this was something that was, when I picked the project, I made sure that, I was integrating it into my regular activities of daily life and tasks and roles as a nurse already. So it is scary to think, oh my gosh, how am I going to do this? I'm looking at the syllabus for the next like 6 weeks or 8 weeks. But, I can only say, if you got through your bachelor's, you got through your master's, you did your clinical, it really, I thought that they were like pulling my leg when they said, it's not going to be bad. Just take a deep breath. We're here for you. And truly, between Dr. Park and the rest of the faculty, they were super, super helpful. And you had that mentor also, that helped you with kind of the writing part of your project. But there's so many cheerleaders within the Commonwealth. It truly was simple.
Yeah, that's great to hear. Yeah. And the support there is one of the things that's really important to, the completion of this process. You're not stranded on an island where you're doing this all by yourself. It's all by your lonesome here. You have people like Dr. Park and the rest of the faculty from the Bryner School of Nursing. They're there to support you along the way. So that's a great point. Erin.
I agree. I mean, when I was thinking about going back, I was worried about it, but I also, when I was getting my master's, I was working pretty much full time through that. And I figured if I could do that, I can do a doctorate while I'm doing it too. And honestly, not that it was easier, it was more incorporated into my regular work. So were there times throughout the program I felt overwhelmed? I feel like if somebody doesn't feel overwhelmed at some point, you're not wired right. I feel like any of these programs are going to get overwhelming at times, right? The most important thing was the faculty had my back and recognized that I needed support, and they rallied. I think I talked to at least 3 different professors who helped me through when I was hitting speed bumps, and they're like, okay, let's break it down. Let's, they took time in addition to what they normally do outside class hours, and were very, very supportive. Dr. Park was my faculty advisor throughout my entire evidence-based project, and she was extremely supportive. So just, I can't overemphasize how supportive the faculty is throughout the process. And
I think they all feel like been there, done that.
Yeah.
And, we're going to be there for you too.
Yeah,
exactly. And so, I try whenever I'm have been doing adjunct faculty with the master's program, mostly the master's program, since I graduated. And I feel like because I've had that support, I can give that right back to my students.
Yeah.
And I think it's so invaluable, because you don't get that everywhere. You really, through the 3 universities I've gone through to get all 3 of my degrees, I can tell you that's not always common at the universities. So just knowing how supportive the faculty was, whenever you feel like, why did I do this? What was I thinking? And just getting you through that time. And it was, that's, I think one of the things that really helps them stand out.
What was the typical time commitment per week, if you can remember? As is it like another 40-hour week job basically doing this, or is it more like, yeah, like 20 hours? What do you have a general frame of reference to compare that to? Either Cynthia or Aaron.
I don't know. So
yeah.
I was gonna say, I think so it's one class at a time, right? I think, is that still how we're doing it for the most part? Like, it's one class at a
Yeah,
time.
that's what I was
So,
gonna say. Yeah, even if
yeah,
there's
so
classes
you're
in a semester,
focusing,
they're one and then the other.
yeah, you're focusing on one thing at a time. So it's not like you're trying to balance 3 different classes and figuring out what's due for what. And each class, you're going to have assignments each week. You're going to have discussion boards each week. You're going to have different goals. So, you know, some weeks you may be spending a little bit more time than others. In certain classes, you're going to be spending a little bit more time than others. But generally, I don't know, Cynthia, like from my standpoint, I just kind of took it like week by week. Like, this is what I need to get done this week. Okay,
Yeah,
you know, and
yeah.
not looking too far ahead.
And what I liked about the way that it was structured was, you know, the big thing is that, which is different from your master's degree going into your DNP, but every class builds upon the end of your project. So it's not
Yes.
like you're doing pathophysiology, you know, when you're a nurse practitioner and you're jamming, you know, 16 weeks of pathophysiology into one portion. It's not like that. It just, you know, you start off with, you know, picking a project and then, you know, getting it all set up, researching why you're doing this. And so that class per se is like probably the first like 20 pages of your paper that you write,
Yeah,
your
you're
dissertation.
writing your paper as
Yeah.
you go. So you're not,
Yeah.
you know, the last semester is not you sitting down to write this huge manuscript. It's like, oh yeah,
Yeah.
I wrote chapters 1 through 3, 2, you know, 3 semesters
No,
ago.
yeah, it's still and that's the nice thing. Like once I was like the third class in, I was like, oh, okay, so this is how it's going to be, because each class builds upon the next, and it just like was very fluid. And you just would go on to the next and the next, and you had that ability of, you know, the faculty worked with each other too. You still had that one mentor to work your way through it. But yeah, it's not like your undergraduate degrees. It's like a pleasant surprise that you're not just doing one thing and then like you have to just stop, drop, and roll to the next class. It's not like that.
Yeah, like there are a lot of, and that's a great comparison, Cynthia, because you know, you look at so I was a history major as an undergrad. I was not a nursing major, and I think a lot of people will be able to tell that by the end of this, because I oftentimes have no idea what you're talking about. But like you had to write a research paper your senior year, right?
Mhm.
But sometimes the things that led up to that were not always preparation for that. It was almost like its own separate entity. Whereas what you're talking about is what it sounds like, at least, is that you're going to slowly contribute to that project over the course of your doctorate studies. So then that way it's something you slowly start to chip away at. And then obviously it culminates at the end of the program, where I'm assuming there's a final submission. But again, it's not like you're writing or working the whole project in one semester. Like, this is something you're slowly working towards. That's great. That's probably going to be a relief for a lot of people when they see, I think it's called the evidence-based project. Is that right, Dr. Park?
Yeah, by the end, you have a poster that you could present, you have a written thing that you could submit to journals, and you're all done.
What's the goal with the evidence-based project, Dr. Park? Like, what's the purpose there is to give everyone like a test of, or I guess an opportunity to do research, or?
Yeah, a quality improvement. You're instituting it where you most often, usually everybody does it where they work, but some sort of quality improvement, and to determine if that is, you know, statistically significant, if it makes a change, and then to be able to defend that and do a poster of that. And some of these projects have really made a significant change and been implemented at their institutions and carried through to other areas of that same institution. I can think at Geisinger, somebody's done it at a convenient care. I'm sorry if you hear my dogs, at a convenient care, and then moved it through to different areas of Geisinger, or you know, carried it through departments. So yeah, Erin and I are working on trying to get hers published. So
Yep.
Yeah.
2 years. It's not too late.
we're getting there. We're getting there.
Yeah.
So, Cynthia and Aaron, would you be able to talk about what your project was and how you selected that? I know that can sometimes be daunting, just being able to like pick a project. It's like, oh man, I could do literally anything, and that's provides some freedom to in flexibility, but it's also like, geez, I don't even know where to start. So Cynthia, what was your project and how did you choose that?
Yeah, so my project was the impact of a nurse practitioner, a cardiology nurse practitioner on the transitions of care for heart failure and their readmissions. We know that heart failure is, a chronic condition that is, the increase, we're spending billions and billions of dollars on heart failure, and it's something that by the year 2030, it's going to be costing us so much. And the way healthcare reform, is going to take us into the future. I wanted to highlight the nursing profession and show that evidence-based information and show, the impact that they can make. So basically, just like I said, the project starts off your classes to obtain your DNP, start with, pulling, your thoughts together on what is your interest. And that's what I wanted to make sure that I implement it into my day too. And I see heart failure patients all the time, and they're always getting readmitted to the hospital, unfortunately. And my goal is always to try and keep them out. But, we know that there is a difference in sometimes the type of management of heart failure patients. So with the collaboration of the faculty, I came up with my question, how does a nurse practitioner impact and influence heart failure patients' quality of life, as well as for healthcare systems to reduce heart failure readmissions. So my project basically walks you through, how a nurse practitioner can try and attempt to reduce heart failure readmissions, keep them out of the hospital while also improving their quality of life, especially within those first 30 days after discharge. Because we know that, for reimbursement rates, et cetera, hospitals and health systems will get penalized for 30-day readmissions. So I compared, because you only have 3 months to gather your information and gather the metrics, it was considered a pilot project for me, and I gathered about 35 patients that were followed by me. The whole nurse practitioner at Geisinger Schmoken, and what it did was I looked at 30 days, and I looked to see how many patients got readmitted to the hospital as compared to patients who were not followed by a nurse practitioner, that they may have just been followed by like a regular family physician or a hospitalist. That we know that using a multidisciplinary approach to heart failure patients will help patients optimize their heart failure. So, if I am the captain of the team, I help collaborate and other disciplines like the social workers and the pharmacists and the cardiologists, and we all work as a team and sit at the table together to come up with a plan of care. So in the end, after gathering all of the metrics, I basically proved that the impact of a nurse practitioner is a positive impact. And not only is it a positive impact to keep patients out of the hospital within those first 30 days after discharge, but I also used a questionnaire that asked them about a patient's quality of life, because that truly is, one of the biggest things that we want to do is we want to improve patient outcomes as well. So, we did a questionnaire when they went into the hospital as well as when they came, 30 days afterwards. And obviously, it did show that patients' improvement in health and quality of life was there when they were followed by a nurse practitioner. So,
Mhm.
but like I said, my project, and Erin will explain too, but my project every semester, every class, you started off, what is heart failure? Why is heart failure important to nurse practitioners, health systems, the patient? And then, you come up with that question. You think about the population you wanted to talk about, you think about what outcome you want to look at, and then you form your question. And then the next semester, you say, all right, how am I going to gather all of this information together?
Mhm.
And then so on and so forth. But yeah, I wanted to make sure that I did something that I do every day in my, profession. And it was definitely a good topic of conversation for me.
Yeah. So you were already working in cardiology then when you decided to pursue that project then. Okay. Yeah.
Yeah.
And yeah,
Mhm.
it's, I would imagine too, the department, the program benefits from that too, because they're going to walk away with, all this research done on a topic that's relevant to that field. So.
Yeah, and the big thing is when you have when you do your quality improvement project, you want to, the goal is to disseminate that information and to, really use that information and use and let people know the evidence-based data that you collected so that we can improve patient outcomes and can improve moving forward with healthcare reform. And like I said, nursing professions, advanced practitioners are going to make a huge impact on patients' health. So that's why it was important to me. But yeah, it's definitely something that the Heart Institute, my administration know my findings, and we're actually talking about truly trying to isolate an advanced a nurse practitioner to lead the way to improve readmission rates, because they're being looked at in healthcare systems very closely, and we want to show that we can make a huge impact on patients.
Yeah, and it's not research for the sake of research. It's not research for you to learn to do research. It's like, no, like that's part of it. The other part of it is like, this needs to be something practical and application based.
Yeah, and Dr. Park, just like Dr. Park had mentioned, the great thing was that the project, the DNP program gets you set up for everything, where you make your whole poster, the campus,
Mhm.
the Commonwealth campus, we go through them, like the print shop and everything, to really get that poster made, and we have the ability to present at the Bloomsburg, well, at the Commonwealth, like interprofessional days, their conferences. Just last week I did the Geisinger nursing conference and presented my findings, and just like Erin said, that she disseminates her information too. It's no good just keeping it on a computer. You have to tell people about it.
Yep. Aaron, how about you? What was your project?
So, working in occupational health, when I was going through my DNP program, I was working in the clinic every day. And a lot of my job is working with truck drivers and doing CDL physicals or DOT physicals. And a lot of people don't realize that truck drivers do have to maintain a certain level of health to maintain that CDL license. And there are strict standards. Unfortunately, a lot of those standards are very antiquated. And we're also talking about a very unhealthy population. The truck driver industry itself, the nature of their job leads them to have relatively unhealthy lives. They have to work very hard to be healthy. They're working long hours. They're sitting most of the time. They have high stress, and oftentimes they're smoking heavily. They have lack of access to healthy foods, is the way I'm going to phrase that. Truck stops often do not have healthy food options. Places where there are healthy food options are not friendly to pull a truck in. So on top of that, we have overweight truck drivers, often with undiagnosed sleep apnea, undiagnosed issues, because if they can get to a doctor, it's not going to be as frequently as we would like them to be because of their work schedules. So those of us who conduct these DOT physicals kind of have to make the most of our opportunity with our time with them, right? Like we need to make sure that we can screen them for diseases and help them stay healthy as long as possible. We're not their primary care doctors though. So that's the problem. We can't diagnose, we can't treat in ways that a lot of primary cares do, because unfortunately a lot of primary cares are not certified to do these DOT physicals. So it's kind of a double-edged sword where we might be identifying something, but what are we going to do with that information? And the way we conduct these DOT physicals is all federally standardized. We have to follow federal regulations in order to certify these individuals. So again, I was looking through what can we do? How can we improve truck driver health? And how can we utilize, is there something on these exams that we're doing that we could be doing better that maybe we shouldn't be doing because it's very antiquated? Well, one of the things that we do on all these physicals is we do a urine dip, a urinalysis, and we are checking for specific gravity, sugar in the urine, blood in the urine, and protein in the urine. And that is truly our only way to determine if somebody is diabetic without getting blood work. And checking urine for sugar is one of the worst ways. It's one of the least sensitive ways to pick up diabetes in an individual. Usually if we're picking it up in the urine, they're not pre-diabetic, they've been diabetic for a while, which unfortunately means that the diabetes is already affecting the small blood vessels in their body. And then it's a matter of hopefully we can prevent from getting worse, and we're catching a little too late in the game. And really, when you look at medical standards for diagnosing diabetes, urine doesn't even come into play generally. Blood work is what we want. That's the evidence-based standard. That's the gold standard for diagnosing diabetes and screening for diabetes, not urine. So I wanted to see if there was a questionnaire that we could do, because trying to do blood tests on truck drivers is really hard. We need to be able to get results while they're in our clinic and give them actionable things that they can do, or, hey, you have this disease, you need to go see somebody. And to do blood work, even if we would do a point of care, it's cost money, which a lot of these drivers aren't willing to pay extra for. And if every clinic across the country doing these exams were to start doing blood work, that's going to increase the price tremendously. Again, simple and easy is what I was looking for. Like, what can we do to help these individuals? So I think, Dr. Park, we kind of struggled trying to develop my question at first. It took me a couple semesters. We kind of circled around my project question for it took a few semesters. And the reason it took a few semesters is because when you start looking up truck drivers and diabetes, there's not much research out there in existence. There's a lot of research in unhealthy truck drivers, but there's nothing really specific to diabetes. So that really created an issue whenever I was doing my research, which is what Cynthia had mentioned. So the semesters that we were doing research, I really had to go at it from a multi-pronged process where I was researching diabetes, I was researching truck driver health, I was researching ways to screen for diabetes in the community without doing an invasive test. And what I came up with was using the American Diabetes Association has a questionnaire that says, are you at risk for type 2 diabetes? I've seen this questionnaire on the back of bathroom stall doors. That's how common it is. And so I was like, I wonder if we can use that in the clinics and just kind of as a screening process, see if we can start picking up a trend as far as, is it accurate enough to help us identify truck drivers who are type 2 diabetic or at risk for type 2 diabetes? And so when I did my project implementation, I took volunteers that were coming in for their annual exams that were not already diabetic. And I said, hey, I'd like you to fill out this questionnaire. And in order for me to make sure that questionnaire is accurate or not, I'm actually going to do a blood test, but I'm going to just take a little drop from your finger and I'm going to get your blood work results right here in the office. The biggest thing was I didn't use a glucometer, which would give me somebody's blood sugar level right now. I used what we call an hemoglobin A1C monitor, which allowed me to get the 3-month average of their blood sugar, which is what we use to diagnose diabetes. And I didn't charge, my drivers for it or anything. It's a kind of an expensive test for out of pocket. It's about $40 test to run that. But I was able to get answers right there. It would be wonderful if I could just use that point of care A1C on every single one of my drivers. But again, it's $40 a test and it's just not feasible for what we were looking at. But I used that to validate the questionnaire that I was using and see how accurate it was. But as it turns out, that questionnaire is only about 50-50, 50% accurate, which isn't great. But the most important thing was when I put my poster together, I took it around to 4 different conferences. I went to Texas, I went to Florida, and I did 2 here in Pennsylvania. And the biggest takeaway was when I did this presentation at the Nurse Practitioner Coalition Conference in Pennsylvania, there was a lot of primary care nurse practitioners. And when they saw my project, my poster, they said, I never would really think about A, asking my patient what they do for a living, and B, saying, oh, they're a truck driver. Maybe I should screen them for diabetes sooner than I would somebody else. So what Dr. Park and I are currently working on is getting this published in an occupational health journal. And I'm really hoping that as more primary care providers see this, it's going to help trigger, okay, make more awareness of this patient of mine is a truck driver. They're going to have more health concerns than somebody else of their age that maybe works a more physical job. And bringing awareness to truck driver health in general. So I think from that standpoint, like, yeah, not every quality improvement project is going to work the way we want it to, right? Like, and that's okay, because again, there's very little research with truck drivers and diabetes. So this is a stepping stone that will hopefully help somebody else take this a little bit further and do something else. Now, if people are thinking, okay, well, if every single test she did was $40 and how many people did she do over 3 months? Because as Cynthia said, like our project implementation is a 3-month long endeavor. So I think it came out to about 120 individuals in my study. And so you think about how much money that costs per test. My entire project was funded through grants that I received through, there's money out there for these things. So I went through the Occupational Nurses Association, and I was presented with a grant, and that grant paid for not only my entire project, but also helped pay for my dissemination costs. So for my travel and these conferences that I went to. So it didn't come out of my pocket. It wasn't, if someone's like, oh my gosh, I don't know if I can afford this. Hey, I got scholarships through organizations, occupational health organizations, to help me pay for schooling. I got help through work to help me pay for schooling. Separate plug, from different topic. But this money wasn't coming out of my pocket. This money was coming from organizations that wanted to help improve occupational health nursing. And so because of that, I was able to do these point of care A1C tests, which is really what was the base of my project, to see if it was valid or not.
Yeah. And again, both of your projects just extremely impactful. It's easy to see why, like, again, what was the importance of doing the project, not only for your own benefit, but for the benefit of the field and for the department and the program that you're a part of. That's certainly outstanding.
We could do one together now.
Yeah.
Truck drivers, smoking, and heart failure.
Oh my gosh.
And sleep apnea.
Yes. Well, and that was the big thing was Kim Olszewski, who I mentioned before, my boss at work and dean at the university, or senior assistant dean at the university. She did her doctorate project similar to mine, but hers was focused on sleep apnea. Because again, that's as Cynthia mentioned, that's a huge issue among the truck drivers. So I kind of took what she did, changed it a little bit to the diabetes, and see what we could come up with, because smoking cessation among truck drivers should be like the next one that somebody does, because holy moly, 2 to 3 packs a day when you've got nothing else to do is nothing. So
Yeah, it's
Haven't
very
done that
rare.
lately.
Yeah. Unfortunately, it's very rare that I get whether it's a, patient who has a heart attack, who has stents, open heart surgery, and they're a truck driver and and if they tell me they don't smoke or they've never smoked, it's like, I'm going to fall off my chair because
unicorn,
it truly
yeah.
does go hand in hand,
does.
that they do that. But I'll just mention right now that, my project didn't really cost me anything. It's kind of two different extremes
Yeah.
that, depending on your DNP, quality improvement project, if you have the tools there already, the biggest thing that everything was truly free. I had to kind of gather, I used a questionnaire already that was already utilized. So I had to get permission for this, but there are projects that are out there that you don't have, that are free,
Yeah, I would say that thinking through the projects that my cohort did, and I think I'm the only one that really had any
Mhm.
major costs involved.
Mhm.
So yeah, and again, I had to get permission from the American Diabetes Association to use their questionnaire. And that's not a hard process. It's sending emails. So when if students are listening to this and they're thinking, oh my gosh, I have to get permission to use these questionnaires that these two, like, it's not a cumbersome process. It's an email, and they're used to having these questions asked. So it's
The IRB is more difficult, right?
yeah.
correct.
And
Yeah.
even that wasn't that bad because you guys had it as such a smooth process for IRB application that, I mean, you walked us through the IRB,
Mhm.
everything. And I don't know, Cynthia, how it was like
Yeah.
through Geisinger's IRB. My company didn't have an IRB, so we had to go through our legal department to make sure that they were okay with everything. And
Yeah. And I think with the DNP too, a lot of the projects that we're doing these kind of pilot, these smaller projects, there's, again, this is a DNP, so we're looking more at clinical versus, using subjects of, research. So when you go a different route for a different type of degree, it goes a little, there's a little bit, you go off a different road, but from a clinical standpoint that you're trying to prove and show evidence base, you're not most of the time, you're not harming somebody, you're bypassing some of these concerns that the IRB may have. But yeah, the process is very simplified, and like, you think, oh my gosh, how am I going to do this? But it's, again, you have the faculty that are mentoring you, and even you have your faculty mentor, and then you have your clinical mentor. You have your faculty from Bloomsburg, but then you have your mentor within occupational therapy or cardiology or wherever you're going to be doing your improvement project. So there's so many different people that are helping you along the way. You're never alone.
Yeah. Yeah. So the other defining feature of the program is the 500 clinical hours. Would you be able to talk about the clinical hours and how you're able to, I guess, work through that while also working, a full-time job as a nurse practitioner, Cynthia?
Easy. You'll get your hours easily.
Right. Job here is done. Next question.
No, I mean, like if you think about it, it's like you're doing this project over like a 2-year period. And if you really think about the amount of your hours that you're putting in is everything that you're doing to gather your information. So whether you're reading your journals, whether you're doing, your IRB application, all of those things are considered your hours. It's, again, different than your undergrad and master's where, you're going out and going into a clinic to do something. It's not like that. This is, your DNP is part of, this is why you try and embed your day into, your project. Because you can, you're doing things at the same time that it's not like, okay, now I have to turn turn myself off and go to my clinical. It's truly not like that. So it's very simple to get your hours. And we were talking about hours before, and yes, I did things throughout the week, but my family knew that I was never going to be around, usually on a Sunday, because I was usually hiding myself either in a room, basement, or my office, doing, that was my big day. So we were talking about that before, what is your day like? And everybody's day is going to be individualized to make that work-life balance. Some people might only work 3 days a week, with their profession, and then do other things. I did not have that ability, but I figured out how to do a couple hours every night. And then like my big day of everything that I would do would be on the weekend. And I felt that worked for me. It's going to work different for everybody. So.
Sure. No, that's helpful. Thank you, Cynthia. Aaron.
Yeah, I'm echoing exactly what Cynthia said. It was very easy to get my clinical hours because, yeah, you're literally doing your evidence-based project. If you are, like she said, you want to make sure that the evidence-based question that you're working on is related to your daily work, and then it's just you're going to work and you're doing clinical hours. And when you're doing your research to find articles, literature reviews, things like that, some of that counts for your clinical hours. Some of the time that you are writing your paper counts for clinical hours. They have it structured out that you can use this many hours, clinical hours to write. You can use this many clinical hours when you're doing this. And then when you're actually working through the evidence-based project implementation in your work setting, that's all that time is clinical. So it's really not hard. You don't really even think about doing clinicals. Like Cynthia said, it's not like you're, all right, today's clinical day, I have to do X, Y, or Z, or for this hour I'm doing clinicals. Or no, it's just you're going to work, you're doing your job, and oh, by the way, you're implementing an evidence-based project on top of it. It's seamless.
Yeah, well, that's probably reassuring for a lot of people. And honestly, I think probably one of my final questions is what was the difference in the coursework between, so at that point you had a BSN, you had an MSN. What was the difference in the coursework in your experience between those programs and the doctorate degree, Cynthia?
Well, I think the biggest difference is, I think we kind of already mentioned it, where, it's a whole different concept and structure when it comes to the DNP program, because you're basically picking what you're going to do to obtain your DNP. Yes, there's a structure of, you're going to get so many, credits for this part of the semester and stuff, but it's not like, okay, pathophysiology or anatomy and physiology and, things like that. And like, you might not like, community practice or whatever, and you might like ICU or something. It doesn't work like that. You're basically, when you start the DNP program, you're picking something that you're interested in. So you're going to make it, work for you. I would have, going into this, if I would have picked something like, something to do with colonoscopies, it just would not have worked for me, or, it's because not that I'm not interested in it, but it's just, I am very passionate about cardiology. Anybody who talks to me knows that I'm passionate with cardiology. So I want you pick it. And that's the difference, because, remembering things with my master's program and even bachelor's, I don't even want to see a kid, thank God, I don't want to see a pediatric kid. No way. I don't want to deal with cancers and things like that. So like, that's the difference. You get to kind of pick and choose what your interest is, because you're already a professional. We're considered these non-traditional students, but finally, I was really non-traditional, because I was the only nurse practitioner in the DNP program with the new CRNAs. So like, I mean, I was really non-traditional because those CRNAs were 20-some-year-old RNs. So that was a little bit of a difference. But we're all professionals, and that's what Bloomsburg University provided us. Like they didn't say, this is what we want you to do for your quality improvement project. They wanted us to put our feedback into how we wanted to obtain our DNP.
Yeah. No, that's great. And Aaron.
So yeah, undergrad, the bachelor's degree, you are learning how to be a nurse, an RN. Master's degree, you are learning how to be a nurse practitioner. You are learning how to be a CRNA. Like you're learning how to be that next level. When it's the doctorate level, the DNP level, you're looking at your profession and saying, how can I improve this? How can I make it better? And how it's, I mean, because I feel like in the undergrad level, in the graduate level, master's level, you're learning about evidence-based practice. You're kind of learning how to implement it, but you're not really learning how to design a full evidence-based project. And that's the big difference, is the DNP is really, really learning the ins and outs of how to fully implement from start to finish an evidence-based project and doing it correctly. Because the worst thing that we can do is base our evidence-based practice on bad research, right? Because not all research is good research. And you kind of learn a little bit about that through undergrad and master's. It's in there. But this is what it is. Like, this is really, really cutting it down and learning, this is good research, this is not good research. This is how you design an evidence-based program or evidence-based practice program. And this is the right way to do it. And in learning that, that is how we make changes in healthcare on any level. I don't care what your master's degree is in nursing wise, whether it's in administration, education, nurse practitioner, CRNA, it doesn't matter. This is how we make the right changes in healthcare that have a lasting effect because we're doing it correctly.
No, that's a great point. Final question. Any final advice for prospective students who are thinking about taking the plunge? I mean, they might be sitting on the fence here. If you had to have any final advice, or I guess probably one of the things that matter to you the most is like, all right, if I'm going to put all this time and effort into this, what am I going to get out of it? Like, what for you was the compelling reason for doing the DNP? As opposed to saying, you know what, I have my MSN, I'm good with that. Like, what was the reason for you to do the DNP? Maybe that might be the most, valuable final advice. Cynthia.
Well, I think that there was several reasons on why I personally wanted to get my DNP. There's a lot of master's degree advanced practitioners out there right now who, and there's no doubt there's a lot of our colleagues who say, why would you want to go back and get your DNP? What is its worth? And because we know that, if you're talking about something, when we're talking about salaries and the financial part of it, you're not going to get that huge raise right away, or you may not ever get it, but I think that over time that may change. I think that, again, that would probably make a great project for somebody to do. But I think the reason why I went back for it is just because I was motivated. I've been a nurse practitioner for so long in my life, so long is the 12 years. And I felt like I needed to go to that next level and get my terminal degree. So, getting my terminal degree where it's the all end for my nursing profession. I never really, I didn't grow up wanting to be a nurse. I was in high school and I truly I was going to go and to be a biology major and other things, occurred. And here I am, I'm a nursing major now. And I kept on going back to school because I feel like I have that thirst and that that urge and that hunger to learn more and more and more. And I'm never, ever sometimes satisfied. I always want to go to the next level, but I also want to be a leader for the nursing profession. And I think that, you know, being a leader for the nursing profession, I want to sit at the table with other people who have their doctorate terminal, you know, degrees, whether it's in physical therapy or pharmacy or, you know, this, we know that, you know, that multidisciplinary approach to care, especially in the cardiology world, but other worlds too, is definitely needed to be effective. And so I felt like I needed to be at the same table with everybody else. And that degree gets me there. But also my last part is that, you know, we know that the nursing faculty in the future is going to be there's going to be a shortage, and the shortage is actually happening now. And we see it, you know, there's a lot of people out there who want to go into the nursing profession. We just can't keep up with the nursing faculty to do this. And I felt like, one, to be a leader in the nursing profession, you know, you do need to get, you know, you need to better yourself and obtain more knowledge and get that doctorate degree. And I feel that, you know, I was at that age that it's going to help me. I might not be full faculty, you know, somewhere, whether it's the Commonwealth or anywhere right now, but, you know, maybe in a couple years when, you know, my kids are out of college and I have, you know, some changes going on, I think that this degree just allows me to have more opportunity than the person who I don't want to say only has their master's, because the master's is very important, but, you know, to have kind of a step up and have that terminal degree, really.
Mhm. Yeah, no, that makes a lot of sense. Aaron.
So a lot of what Cynthia said, I would say is similar, it's the same for me. So when I was going through my bachelor's degree, I tell this to my students, I struggled really, really bad. And I wanted to change my major multiple times. I had to repeat classes multiple times. Like, I barely got through my bachelor's degree program by the skin of my teeth. And I'm not afraid to tell people that, because I think they need to see that it's okay to struggle. It's okay throughout your nursing career. Like, I still became a nurse. I still passed my boards. Did I have to work really hard for it? Absolutely. It's very difficult, and it's difficult for a reason. You know, people's lives are in our hands. It should be difficult. But because I struggled so much with undergrad, I did not go back to get my master's for years, because I didn't have the confidence that I needed in order to get my master's. I didn't think I was smart enough. I didn't think I knew what I was doing. But retrospectively, undergraduate, when I explain to people, undergraduate nursing is learning a new language. It is a completely different thing than anything that you could possibly be used to, because medicine in itself is its own language, and it's a lot to learn. And then I finally decided, you know, I was about 10 years into my nursing career, and I said, I'm ready for a change and I don't know what I want to do. So I just started looking at jobs, and I always was afraid of becoming a nurse practitioner, because I didn't want to be the person that just got stuff loaded onto them in a doctor's office because they're the nurse practitioner. Well, they're the nurse practitioner. They'll see this patient because they're the nurse practitioner. And I had this perception of what a nurse practitioner did. And I didn't realize what a nurse practitioner could be. And the more I started to research that and realize there's an adult gerontology track, because, like Cynthia, I love children. I don't want to take care of them in a professional setting, because that scares the ever living daylights out of me. They're fragile little creatures, and I don't want to be responsible for that.
Right.
So I found there's adult gerontology nurse practitioner. So I went that route. Was it difficult? Of course it was. But because you're building on that language that you already know, I didn't think the master's program was nearly as difficult as undergraduate, right? Because I have all this experience that I'm building on. Well, then I was, you know, became a nurse practitioner. I was like, all right, I got through that. I don't really know that I want to become get my doctorate, maybe eventually. because, yeah, I should probably help teach because there's a professor shortage for nurses. And then the pandemic hit. And it kind of just threw off my whole career trajectory that I kind of had in my head after I graduated with my master's. Remember, I graduated my nurse practitioner in 2019, about a year before the pandemic hit. So I had been in clinical practice for about a year. When the pandemic hit, our hours got cut back to about 30 hours a week. So we got, 10 hours cut each week. So that's when Kim was like, this would be a really great time for you to do this because you suddenly have 10 extra hours every week that you can play with here.
Yep. So
I kind of, all right, is this something that I really want to do? And she was so incredibly supportive. I cannot emphasize, I would not have gone through the program if it wasn't for her, honestly, because she was so encouraging. And such a cheerleader throughout the whole entire thing. And then again, the faculty at the Commonwealth were so incredibly supportive. And I just kept telling myself, yes, like we need nursing professors. We need nursing professors. We need nursing professors. This may not be your full-time job, but you need to do it. And now where I am in my clinical practice, again, I'm not in a clinic every day. I am answering questions for clinics every day. I am using that knowledge that I obtained through my doctorate program to write policies, write procedures, again, help our clients make sure that they are following and meeting regulation standards. And I know that's something that I would not have had the opportunity to do had I not gotten my DNP. So yeah, whenever somebody asks me why should I go back for my DNP, or why should I get my DNP versus my PhD? Because that's another question I get, because certain people have this perception in their mind that a PhD is better in some way than a DNP. And it's no, like we need both. We need both is in the nursing field. We need the people that will go out with the PhDs and design the research. But then we need people just as much with the DNPs that can help look at that research and implement it into evidence-based practice, because without both pieces, it's never going to work. So knowing how to take that evidence-based research that the PhDs are doing and turning it around into clinical practice it puts all the puzzle pieces together. And just being a part of that and getting to explain that to people, because again, DNP, people just think, oh, you have your PhD because you're a doctor. No, I have my DNP, and let me tell you why, and let me tell you about it. And I don't regret it for 1 minute. I think it was worth every single penny that I spent and every single scholarship penny that I received. So yeah.
No, that's great. Yeah. And again, it's at the end of the day, you got to want to do it. Certainly going to do work, certainly going to be a lot of work. But there's a lot, I guess what they would say, like in the business was like ROI. The ROI in the degrees going to be very high. So I really appreciate it. Dr. Park, Cynthia, Aaron, thank you so much for your time. Really do appreciate it. For those of you who are watching live or are watching the recording, please do not hesitate to reach out to myself or Dr. Park. We are happy to help in any way that we possibly can. We work for you, and we're happy to do it. So we look forward to hearing from everybody in the future, and certainly hope you have a great night. Thank you.
Thanks.
Thank you.